A chance to speak to a local pharmacist that works at Walgreens. Her name is Caitlin. We decided to have Passion interview her to get some insight on acetaminophen.
So my name is Caitlin Rao. I'm a pharmacist here at Walgreens. I understand you have some questions.
Yeah, we have interview questions. So our first question, how does acetaminophen, we're going to edit. Acetaminophen reach the location where you're feeling pain?
Well, so it depends on the type of acetaminophen you get. So it can be given IV or it can be given by mouth as a pill form or liquid form. But its actions work in your central nervous system. It can work to reduce fever by inhibiting prostaglandins. And it can also, it's kind of misunderstood how acetaminophen works, but it can also inhibit the cyclooxygenase pathway, and that's what stops your pain.
Very nice. Okay. What is the normal dosage given in medicines?
So regular strength Tylenol is 325 milligrams, but it can go in extra strength, and it can also go in multiple prescription forms as well as pediatric forms, which is normally the liquid formulation.
Okay. Is Tylenol like the mainly what acetaminophen is?
Yep, so the acetaminophen is the generic form of Tylenol, so that's its trade name.
Okay. And can people build tolerance to this?
Not so much tolerance, but sometimes your pain can be refractory, so it can not work as well, just by having too many, if you build up too many receptors, or your receptors are not responding to the medication as they used to.
Okay. What are the risks of taking too much?
Liver toxicity is your biggest risk. If you go over 4 grams a day, it can be a risk to your liver.
Okay. So what other medicines contain this?
Contain acetaminophen. A lot of prescription medications will have acetaminophen in combination with other medications. A lot of pain medications, like your hydrocodone and oxycodone, will be in combination with acetaminophen, as well as other coating products. That's most typical.
Okay. How are the medicines with acetaminophen made?
How are they manufactured?
Yeah.
I don't know.
Okay,
That's not a question for me.
So how can I tell if medicines contain acetaminophen?
All medicines have to have it labeled by the FDA. That's a requirement that they have to have it labeled that acetaminophen is in the product. That's by law. So it should say acetaminophen or APAP. APAP is the shortened version.
Okay. And what are the contraindications for acetaminophen?
So liver toxicity is your biggest one. If anyone has liver disease, hepatitis, or any liver impairment, that's your biggest contraindication. But there's a whole, anyone that takes in too much alcohol, or if they have certain liver enzyme deficiencies, I mean, the list goes on and on. If you have renal or kidney damage or insufficiencies, that's another big contraindication.
Are there any other possible side effects besides liver toxicity?
Not really.
That's the main one?
Yeah, that's the main one. In doses, that are higher, sometimes you can get a little bit of nausea, but yeah, the biggest thing you have to watch out with acetaminophen is liver toxicity.
Okay, thank you for your time.
Thanks for watching.